Visiting Cambodia, it's very clear to me that treating haemophilia in a low-resource environment is very challenging. However, we can see here that application of the comprehensive care model of treating haemophilia is enormously beneficial to patients. The provision of holistic care, such as social work, physiotherapy, patient education, and liaising with patient advocacy groups is extremely important and clearly benefits patients with haemophilia. Developing this model further is very important. It's particularly important to be able to diagnose patients. There are very many patients in Cambodia who don't have a diagnosis. Until they have a diagnosis, then it's not possible to offer them the valuable support that they're getting in the hospitals here, and also it's not possible without a diagnosis to liaise with the providers of care to ensure that provision of treatment is improved.
Since being here in Cambodia, I'm even more convinced of the importance of physiotherapy for patients with haemophilia. Even with the limited resources in terms of factor, there is still an awful lot the physiotherapist can offer in terms of controlling and helping with the symptoms of an acute bleed. These patients need to know how to recognise when they have a joint bleed and what to do in their home environment. So in terms of protecting that joint until that bleed settles, if they're not having any factor treatment. Patients that then have arthropathy from continued joint bleeds also need to know the importance of exercise to keep that limb strong and flexible so that they can do the activities that they need to do each day. There is also a need for patients to be able to manage their pain levels. So physiotherapy has a really important role in helping these patients recognise that some of the pain is from arthropathy and not from a joint bleed, and ways that they can help manage these pain levels themselves.
I've been a haematology nurse for many years. When I signed up for the project, I thought I was coming to provide support and assistance from the West. Actually, now I've been here in Cambodia for a week, I've learnt so much from the Children's Hospital and the doctors and nurses here, how their treatment is tailor-made to every child with the limited resources that they have. The team around the child is outstanding, the social workers, the psychologists, the support for the families is outstanding. And if you're thinking that you would like to help in a third world country, I would strongly advise you to get in touch with the project and give it some consideration, and I would definitely be back.